Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our hospital system general director, giving you the update from Albany Medical Center. Today is Thursday, August 6th. All right, let's jump into the numbers. These are graphs that we look at all the time. The first one is the COVID-19 admissions to the hospitals in the 8 counties of the Capital Region. Just like on Tuesday, you can see these numbers remain about the same as they've been now for quite some time.
More than a month, Dennis.
More than a month.
More than a month.
Next graph is activity inside here in the medical center, admissions above the line and discharges below the line. And that looks very familiar as well. And finally, let's jump to our morning census. You can see we're still hanging out in that range that we've been for quite some time with COVID-19 here in the hospital. And Fred, I think this speaks to the fact that, as we said on Tuesday, people are doing the right things. And so we're keeping those numbers lower than they've been in quite some time.
They are, Dennis. The 3 things that are so important: wear a mask, social distance, and wash your hands.
Wash your hands.
And people are obviously doing that. It's really good.
Very good. Today, really, we're just going to focus on welcoming the students back from the college. We have a very special video from our dean, Dr. Verdile. Let's talk about him for a while. He's been the dean here now for 20 years.
20 years.
Remarkable.
Yeah, it is. I think he's probably one of the longest-serving deans in the country.
He very well may be. I know he's the best dean.
He's definitely
the best dean.
Absolutely.
He's a Troy native, and in point of fact, he's a graduate of Albany Medical College, as am I. He was class of '84. I was class of '92. There's some good photographs in here that are probably, maybe we shouldn't look at them.
you don't want to look at those. You don't want those posted, Dennis.
Yeah. But Dr. Verdile is been our dean now for these 20 years. He's very capable leading the medical college in all its 3 important missions. And he welcomed the students back on campus earlier this week. And what we'd like to do now is give him an opportunity to address the workforce himself.
Welcome to all of our students that are new to the campus, our medical students, our nurse anesthetist students, and some of our graduate studies students in the basic sciences. So the medical school class is a class that will be 145 students that are seated. We had an application pool of about 11,000. We interviewed 700. About a third, a little more than a third of the students are New York State residents. 51% are women. And it is probably the most diverse class we've seated here at the medical college in a long time. So very, very happy with the quality and the diversity of the student body we've recruited. Because of the lingering and prolonged tail on this COVID-19 exposure, we've done quite a bit to change the way education is being delivered in the college. So asynchronous learning, a lot of it online, opportunity to interact with faculty at a variety of steps through the process. Clinical decision making and clinical skills acquisition will still be done in our Patient Safety and Clinical Competency Center, but obviously much smaller groups and with social distancing and wearing masks. We are masking everyone in the building now, both in the college and in the hospital. We're doing temperature checks on the way in the doors, temperature and symptom checks, and then employees are responsible for self-monitoring themselves at home. So if they have any symptoms, fever, cough, sore throat, then they are to self-quarantine for 14 days. Those students that come from any of the hot zone states are required to be tested day 1 while they're on campus, and those test results come back in about 6 or 8 hours, and then we'll know what students are at risk and then follow their recommendations if they are positive for coronavirus. We've trained them back, make sure they're all trained in PPE and how to place it on and take it off appropriately without jeopardizing themselves or infecting themselves. At the peak of the pandemic in New York State, our faculty had about 35 clinical trials going on at once in the hospital, which was incredibly robust from 0 to 60 right away. In addition, we were one of the first FDA-approved sites for the convalescent serum for patients that were acutely ill. And finally, we had FDA approval for remdesivir in patients that were experiencing COVID but not critically on the ICU. On the basic science side, Dr. Dennis Metzger and his Department of Immunology and Microbial Disease, who have a lot of experience with vaccine development, have had virus in the college since probably early March and have been working to find a solution to a vaccine as soon as possible. So it's always an exciting time in the fall when students return to campus, especially our new students. We always welcome them and wish them the best of luck on their endeavors here at the college. And we are here to help them, and we are confident that we are providing a safe environment for them to learn that's COVID-free and that they will excel in their discipline.
Thanks for that wonderful message, Vince, welcoming the students.
Yeah, it is great having them back. They bring a certain energy back on campus when they come, and we know that they're going to do great things. And so
hustle and bustle in the halls.
Yes, for sure.
With their masks on.
With their they are wearing masks,
they
for
are
sure,
masks.
and that's very important. So, very good. Now, Fred, I think you were also going to challenge the people who are watching this video to see if there's something that they can pick up on that we're not going to tell them, but maybe somebody out there has noticed.
There is something interesting about today's video. So if you know what that is, please email Dennis and I and let us know.
And
we'll see if anyone picks up on it, Dennis.
The first one who gets it right, Fred will buy them coffee at Dunkin' Donuts.
Absolutely. And a donut.
All right, very good. That'll do it. We'll be back again next week,
Yep.
and we look forward to that. We hope you have a safe weekend, and we hope the weather is good. We thank all of our staff who are working here on the weekends 24/7, doing a great job as always.
Thank you.
Once again, we ask that you please take care of yourself, take care of each other, and we'll see you on Tuesday.